All right, so we had some pretty explosive news that came out yesterday that Joe Biden decided to basically go balls to the wall and create a new vaccine mandate. Now, this is more of a soft mandate, and we're going to get into a lot of the details here, and then I'm going to give you my thoughts on it. But understand up front, this isn't a fear-mongering vaccine mandate that people were worried about, where the government is going to send troops to your door to forcibly inject a vaccine or anything like that. It's really more of a soft mandate in that they are requiring employers with more than 100 employees to basically offer their employees, hey, you got to either get the vaccine or you're going to have to face weekly testing and prove that you do not have COVID. So that's essentially the basic outline of it. But there are a lot of more details within this new action plan that Joe Biden came out. So let's go ahead and discuss what's actually in this, and then I'll give you guys my thoughts on this. But key parts of Biden's plan to confront the Delta variant surge. So again, just a reminder, the pandemic is nowhere close to being over. We have a massive Delta surge right now that is taken over, especially parts of the South. And I happen to live in the South. I live in Georgia, and my hospitals are still facing shortages in terms of ICU bed capacity and other supplies necessary because there are a lot of unvaccinated people that are still flooding into our hospital system. And so this is what Joe Biden decided to basically do about that. So President Joe Biden has unveiled a new action plan to confront the COVID-19 surge that's being driven by the spread of the Delta variant. It mandates vaccines for federal workers and contractors and certain healthcare workers, and requires employees at companies with more than 100 or more workers to be vaccinated or tested weekly. And it lays the groundwork for a booster shot campaign and recommends that large venues require proof of vaccination or a negative COVID test. And the plan also makes recommendations on keeping schools open. So here are basically the most important outline pieces of it. So all federal workers and contractors must get vaccinated with limited exceptions. Private employers with 100 or more workers will have to require them to be vaccinated or tested weekly, and employers must provide paid time off for vacation. So vaccination, sorry. So this is really the most important part, right? Because the idea that I had when I first was opposing vaccine mandates was like, I don't want a situation where, one on the one hand, you have like police who are going around and harassing people who aren't vaccinated in public spaces. I don't want to have the police or any other sort of like forceful, violent authority that is stepping in to mediate the process of vaccine mandates. But in addition to that, part of the reason why a lot of people have remained unvaccinated is because they simply are worried that they are going to get symptoms from the vaccine, which is a reasonable thing to fear, even though it's worth it to get the vaccine and it will protect you from actually getting COVID and the symptoms that would result from getting a terrible COVID case. There can be associated symptoms from vaccinations. And so a lot of people who are on the verge at their jobs or are worried that they are not going to be provided for if they have symptoms, they can't miss work. And so they're fearful of that and they have decided not to get the vaccine. So it's pretty important that you provide paid time off for people to get the vaccine in addition to requiring it. And so it looks like if they're doing that, at least that seems like you're covering most of the bases here, at least in my opinion. So 100 or more workers, you'll either have to get vaccinated or you'll have to prove that you don't have COVID every week. Okay, that seems totally reasonable, at least in my opinion. I don't think that that's some crazy authoritarian overreach. The fact of the matter is, we're still in the middle of a pandemic that should have been over domestically a long time ago. We should be looking outwards towards helping a lot of other countries get access to the vaccines by doing things like relinquishing the IP patents and etc. But here domestically, I mean, it's pathetic, the state that we're in right now. We're basically almost where we were in January of last year, which was the peak of the surge of the original variant, and now we're basically back where we were at square one with the Delta variant. So we haven't really improved other than getting like 2/3 of the country or so fully vaccinated. So basically, we have to do things like this in order to move the ball in this progress, because what we've been doing up until this point just simply has not been working. And so I kind of like this. I think it's better to go about it in a soft approach way than actually like forcing people to go get vaccinated physically. But the continued requirements are about 17 million healthcare workers in hospitals, clinics, and other facilities that accept Medicare and Medicaid payments must get vaccinated. For booster shots, federal agencies will lay the groundwork for a smoother booster shot campaign starting the week of September 20th. And if the FDA authorizes or approves the boosters, so anticipating that is going to be happening. And also important to note here that pretty much all of these international organizations that have been pushing for global vaccine access, because we still have this ongoing vaccine apartheid with a handful of wealthy countries that are basically hoarding all the vaccines and protecting these big pharma companies and their patents so that the rest of the world can't develop vaccines and give them to their population. So basically all of these international agencies are telling us don't do booster shots until everybody else around the world is getting their first shots. And it just seems like we're just going to roll straight past that and ignore them and continue to vaccinate our own population while ignoring the rest of the world. So although I do think it's a good thing and it's not necessarily a one or the other approach that you have to take, right? You can get get a booster shot here and also be relinquishing the patents so that everybody else internationally can supply their own populations with the vaccine. We should be doing an all of the above approach, but that's where we're at right now in terms of the booster shots. And it will also initially not be for the wider population. It will probably be for like booster shots for immunocompromised people or elderly people, etc., to initially begin. And then on masks and testing, the number of pharmacies offering free testing will be expanded to 10,000. Walmart, Amazon, and Kroger will offer at-home COVID tests at cost, about a 35% savings for consumers, which this is pretty big. And honestly, why the fuck have we not been doing that the entirety of the pandemic? You're telling me we've been offering for-profit COVID tests for people to go and get price gouged at the pharmacy while they're trying to test for COVID and do the responsible thing? It's just a complete joke that we haven't been doing this from the beginning. I mean, really, the tests should be freely provided to everybody at free at the point of service. There's no reason why these should be costing anybody at all. There should be no barrier cost-wise to getting a COVID test. It's absolutely ridiculous, but people should be able to get these for free, at least in my opinion. And they continue on COVID care, saying that the Pentagon will double medical teams helping local hospitals overwhelmed with the virus patients, and federal agencies will boost shipments of a COVID-19 treatment known as monoclonal antibodies by about 50%, and medical teams will be dispatched to help on that. So that's basically the outline, the general idea of what is included in this. Now let's get to some of the takes that I actually agreed with on this in terms of how this is going to be implemented. So here from Natalie, sure, this is one reason that mandates aren't exactly the silver bullet that some people insist they are. And so what is she talking about? Well, here from Dave, it should be interesting to see how OSHA, which is the agency that Joe Biden went through to enforce this vaccine mandate, which is the Occupational Safety and Health Administration, which is basically tasked with keeping workplaces safe in the United States. And so it does seem like he actually has the authority legally. I do agree with like the legal precedent for this because it's pretty simple. I mean, OSHA is tasked with protecting workplaces and the health and safety of workers within those workplaces. It seems pretty obvious that having everybody vaccinated within those workplaces would be a part of that process. That doesn't seem like it's an overreach or anything crazy. It seems like it does fall pretty squarely under what OSHA's responsibilities are. But again, from Dave saying, it should be interesting to see how OSHA enforces a nationwide vaccine mandate that applies to 80 million workers. Due to chronic understaffing, it would currently take the agency 160 years to inspect every workplace under its purview, and there is one inspector for every 83,000 workers. So OSHA clearly has been gutted over the last couple of decades and needs to be significantly beefed up if you're going to seriously enforce a vaccine mandate like this and check every workplace and make sure that they're enforcing it in the ways that you actually want to. And so that's why I think Natalie made a good point here, saying that this is just one reason why mandates aren't exactly a silver bullet, as some people insist they are. Mandates are good and can help boost vaccination rates, but aren't an excuse to abandon other aspects of vaccination campaigns. Proactive outreach and persuasion still key. And obviously another thing that I would say is still key is you got to implement nationalizing big pharma. You have to implement a Medicare for all single payer type system so that people are not constantly in their everyday lives getting screwed over by these gigantic pharmaceutical producers and health insurance companies. If you have a healthcare system where people are not getting ripped off and not getting price gouged and not getting bankrupted and not having their family members die because they can't afford basic medications or treatments, that would be a healthcare system that would be more conducive to actually convincing people to take a vaccine in the first place, right? So long term, those are the types of things we could do to build trust within these vaccines and future pandemics. But again, this is not going to be a silver bullet, right? But at least hopefully it will boost vaccination rates, or that's the idea. Now, to give a different side of this, COVID, here from James, COVID has now killed more Americans in 18 months than all the wars of the 20th century combined, and people are out here complaining that requiring unvaxxed workers to get tested once a week is an unreasonable burden. Be serious. And I agree with this take, okay? Listen, we have like 600,000 or 650,000 or whatever Americans, 1,000 Americans who have died so far over the course of this pandemic. Is it really that much to ask? Again, you're not saying you have to get this injected into your arm. You're not forcing or holding anybody down or doing it in any physical way like that. You're simply saying you have the choice of either getting vaccinated and making your life a whole lot simpler and easier, or you just got to show up and get tested once a week. And that's that. I mean, it doesn't seem like it's anything unreasonable or wild or crazy, at least in my opinion, but conservatives have been absolutely freaking out about this and basically calling Joe Biden like, the next authoritarian fascist leader because of these steps. I think it's a complete ridiculous overreaction, and that this isn't unreasonable by any stretch of the imagination. And again, I do think that he has the legal authority to do this. Here from U.S. Code 29 U.S. Code 654, duties of employers and employees, the duties of OSHA. So each employer shall furnish to each of his employees employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm to his employees. Seems like that COVID would fall under this exact category, right? And would fall under this as a recognized hazard that are likely to cause injury to workers. So again, I do think that he actually has the legal authority to do this, and it does seem like we are going to be getting some pretty significant challenges in terms of who is going to be bringing legal cases against this. I'm sure every Republican who wants to bring some attention to themselves is going to be challenging this legally, and so they're going to be facing this. But will it stand up in court? I actually think it might, because again, I think this does fairly fall under the purview of what OSHA is supposed to do as an agency. And again, he also is backed by the majority of American people on pretty much all of these vaccine mandates, if you want to call them that, even though they're more, again, soft mandates, because you're not really mandating them. You're just giving people the opportunity and saying, if you want to participate in public society and civilization, right, as a collective, then you need to participate by protecting public health, right? There is no individual way or individual freedom approach to solving a public health crisis, to solving a pandemic, and the majority of people seem to be agreeing with them on that. So to require it for planes, basically 61% in August supported this, requiring them to stay in a hotel, 53% supported it, attend events with large crowds, 58%, dine in a restaurant, 53%, and go to office or work site, 56%. So it seems basically like the American people are on his side on this issue, and there's going to be, of course, conservatives are going to be coming out and freaking out and hyperventilating on this and trying to play it up as much as humanly possible to feed their rabid base. But it seems like this is pretty reasonable and honestly long overdue. Obviously, we're not just going to be able to keep going on our current trajectory of having all of these hospitals all around the country being at capacity and filled up. It's simply not acceptable. Pretty much everybody who is in hospital and dying from COVID is unvaccinated. So listen, we got to get everybody vaccinated. Again, you're not going to be holding anybody down. You're not going to be forcing them against their will. You're just creating incentives and pressures to make it a lot more easy for people who are vaccinated and make it slightly more difficult and inconvenient if you want to remain unvaccinated and continue jeopardizing your own health and the health of the employees and workers that are around you.